Hello, everybody. I did my PowerPoint on borderline personality disorder. What is borderline personality? Borderline personality is also known as BPD. BPD is a mental condition in which people has a long-term pattern of unstable emotions. BPD is a mental health disorder that impacts the way you think and feel about yourself and others, causing problems functioning in everyday life. Symptoms of BPD. You have intense fear of abandonment, even going to extreme measures to avoid real or imagined separation or rejection. Patterns of unstable, intense relationship, rapid changes in self-identity, shifting goals and values, seeing yourself as bad or as if you don't exist at all, suicidal threats or behaviors, and self-injury. Here's a link of YouTube video that I will show at the end of the presentation. Causes of BPD. Research suggests that genetics, brain structure and function, and environmental, culture, and social factors play a role and increase the risk of developing BPD. Family history. If you have a family member that is diagnosed with BPD, the chances of developing BPD are higher. Brain factor. Studies have shown people with BPD can have structural and functional changes in the brain. Environmental, culture, and social factors. People who have BPD have reported traumatic life experience such as abuse, abandonment, and adversity during childhood. Test and diagnosis. A licensed mental health professional such as a psychiatrist, psychologist, or clinical social worker can diagnose BPD. They complete a thorough interview, perform medical exams which can help other possible causes, obtain family history of mental illness. Co-occurring disorder can make it harder to diagnose BPD. For example, people with BPD most likely experience multiple symptoms such as depression, bipolar disorder, anxiety disorder, substance abuse, and eating disorders. Treatment and therapies. BPD is difficult to treat. With newer evidence-based treatment, people with BPD experience fewer or less severe symptoms and have improved quality of life. Family plays an important part of treatment. Support system. Cognitive behavioral therapy teaches you how your thoughts and behavior affect your emotions. Mentalization helps you understand your behavior and other people's behavior. And transferences helps you understand how you see yourself in a relationship. So cognitive, mentalization, and transference are therapies that can help you basically help you understand how you behave, how other people behave, and differentiate yourself between others, and not make you feel lonely or the guilty one. And also, as I mentioned before, cognitive behavior teaches you how your thoughts and behaviors affect your emotions. Medication and life expectancy. Antidepressants, mood stabilizers, psychotics may be prescribed to people who have BPD. 80% with BPD have suicidal thoughts. Around 4 to 9% of the 80% commit suicide. Statistics. According to the study conducted on personality disorder by the U.S. National Institute of Health, NIH, 5.9% of the U.S. population has BPD. 6.2% has NPD. Some people have both diagnoses. About 10% of the U.S. population has BPD and NPD. 1 in 100 adults have BPD. 70% of those patients are women. And this is my reference. Now I'm gonna show you the video that I have that explains a little bit more of the sentence and goes over what I just explained here in the PowerPoint.
Imagine this. You're a flame that is constantly burning, fueled with deep, deep emotions. Every emotion that you feel it so deeply and so intensely that it just burns you up. You don't feel happy, you feel joy. You don't feel sad, you feel empty. You don't feel angry, you feel rage. You don't feel anxious, you feel paranoid. Your mood can swing over the smallest thing. You're a ticking bomb waiting to blow off. You're an extreme roller coaster that never ends. Sometimes you fail to identify your emotions, and to others you might appear as a storm that comes and goes. The smallest thing can set you off. The tiniest hint of rejection can make you feel worthless and spiral you down into self-loathe and emptiness. Most of the time, you don't even know who you are, and sometimes you fail to recognize the reflection you see in the mirror. In your world, there is no gray zone. The world you live in is black and white. You either feel everything or nothing at all. They are either good or bad. It's either love or hate. When you love someone, you love them so much and so passionately that it burns you up. And when you hate them so much and so passionately that you want to burn them up. You fail to see the middle ground in everything. You're constantly living on the edge, and it's tiring, it's overwhelming, exhausting. You also live under the constant, extreme fear of abandonment, that everyone's going to leave you eventually. So you're always on the watch for a sign of someone leaving you. And when you do feel you're going to be abandoned, let it be real or not, you either beg for them to stay or you leave before they do. Because you cannot bear with the overwhelming thought of being abandoned by somebody. So you constantly find yourself pushing away the people you love most. To top it off, you are constantly paranoid that people are out there to get you, to harm you. So you don't trust anyone, not even yourself. All your emotions and thoughts, everything just overwhelms you. And to release that overwhelming feeling, you let your impulsivity take over. And you lose touch with reality as your impulsiveness spirals out of control. This is just a glimpse of what it's like to have borderline personality disorder. But despite this, as borderlines, we are passionate. We're insightful. We're masters at living life in the moment. And most of all, we've been through so much emotional pain that our skin has become tough. As borderlines, we are resilient. And we know we'll be okay, no matter what challenges we face.
So I hope you guys learn a little bit about borderline personalities, and thank you.